meeting is being recorded.
Okay. Good evening or afternoon, everybody, and thank you for attending our December webinar, the last of 2024, which is a joint presentation between the Education Committee and the Government Relations Committee of the Wound Healing Society on the topic of navigating our governmental systems to better impact our research and patients. Please note, if you have any questions throughout this evening's presentations, use the Q&A box and we'll address as many questions as possible at the end of the webinar. And as a reminder, this webinar is being recorded. I will now pass you over to Dr. El-Masry, who is moderating this session, to introduce himself. Thank you.
Thank you, Kath, for introducing me. And I'm happy and it's my pleasure to moderate this session today. And I'm a plastic surgeon scientist and co-chair of the Education Committee of the WHS and assistant professor at Department of Surgery, University of Pitt. And I would like to introduce our presenters today. I will start with Christina Megal. To you, Christine.
Thank you, Dr. El-Masry. I'm Dr. Christina Megal. As he mentioned, I am a nurse practitioner by background, and I'm an active member of the Education Committee with the Wound Healing Society. My professional role is as an assistant professor at the Medical College of Wisconsin in Milwaukee, Wisconsin, and I am the clinical director of our woundinostomy program, where I am an active clinician and see patients regularly. Welcome to our WHS seminar. I'm going to throw it over now to Dr. White-Chu.
So it looks like there is some connection problem with Dr. White-Chu, and she is with us
Are
now.
you able?
Yeah,
Are
go
you
ahead.
able to hear me now? Oh,
Yes.
I'm terribly sorry. Yeah. Okay. Thank you very much. Sorry, we are having some technical difficulties. My name is Dr. Foy White-Chu. I'm a geriatrician and a wound healing physician, associate professor of medicine at Oregon Health and Science University, and work primarily at the Portland VA in Portland, Oregon. I'm also the chair of the Government Relations Committee for the Wound Healing Society, and we felt that it was super important to align with the Education Committee to bring you some basics on how policy happens in terms of how it impacts both our research and our patients. And we hope that this will be some good fundamental information so you can feel better informed going forward in terms of either research proposals or working through CMS and FDA rulemaking, or also advocating for our patients for different policies. So let's get started. And I think Dr. Megal is going to do the slides.
Yes, I'm in the process of sharing now. Bear with me while I get those up and ready. And here it comes.
We'll get there, guys. Yay! Okay, first slide's up. Okay, so this is navigating our governmental system and Zoom tonight, apparently, to better impact our research and patients. Next slide. So our objectives today, we really want to outline policy that impacts both wound research and clinical care, explore CMS policies related to wound care. There will be a separate session, if I remember correctly, about FDA. So we're just going to concentrate on CMS when it comes to rulemaking, but they have some similar issues. Determine strategies to advocate for wound research and clinical care, and also review our Wound Healing Society advocacy platform. Next slide. So let's just start with, maybe you remember how a bill becomes a law. But there's even something more fundamental to that. And what we're going to talk about is on the federal level, but can also happen at your state level. So let's say you as an individual have a concern and you're a constituent. That means you are a U.S. citizen and that you hopefully vote. But you would go towards your representative, either the House or the Senate, and say, I'm running into this barrier with regards to my research, or I'm running into this problem when taking care of my patients, providing high quality care. It's great if, as an individual, if you do go, they want to hear from you. They are so happy to meet with you. They want to hear your stories, and they will respond to you. There are staff members in those legislative offices that have healthcare portfolios, and they are the ones who are usually on top of these. And if they start seeing a trend of a problem, then they start to investigate it a little bit. So there's power in one person, but there's even more power in numbers. And that's where trying to align your stories with organizations such as the Wound Healing Society to have even more voices raised and even more constituents bringing problems to the members. That's when we're talking about your representative in the House or the Senate. When they start to see these stories, as I mentioned, the staff member having a health portfolio would then start to collect data and want subject matter experts. And everybody on this call today is a subject matter expert. You know issues related to your research. You know issues related to your patients, and you can give that information. Now, say your representative serves on a committee or is chair of a committee that has some healthcare alignment and might be able to even propose some information after they've gathered stories and data and maybe a policy fix. Everything has to go through committee. So a member of Congress cannot just stand up before Congress and say, hey, I'm hearing about this problem, we need to fix it. No, everything is organized through committee. And committees have hearings where they hear from subject matter experts, and then that influences policy down the road. The policy that tends to get passed is the ones that are bipartisan, and in every committee has a chair and a major, and also a co-chair. And whomever is the majority in Congress will be the main chair, and the co-chair will be the minority in Congress. So in the upcoming change of the election, the Republicans will be the main chairs of the committees, both in the Senate of the House, this coming, starting in January. Next slide. So this is a very busy slide. I was a health and aging policy fellow a couple of years ago, but it helps understand how all of these branches come together. You probably learned that we have our three branches of government. That's the Congress, where House and Senate are, the executive branch with the president and his cabinet or her cabinet. And then you also have the judicial branch, which is not on here, but they do highlight on this, the state government, where really for clinicians and research, Medicaid comes into play in terms of how we pay for care. Notice with the Senate and the House, you have your member offices, and then there are all these committees that tend to influence health, in particular aging and health. So there's a little bit bias here, but I just felt like this was a good schematic to see all the different committees. Next slide. So looking more broadly at federal committees relevant to healthcare, on the left here, we have the Senate. The Committee on Finance. Finance is Medicare, probably our largest payer, as well as VA-related care. So VA, any kind of policy mandates tend to go through the Committee on Finance, along with Medicare. And then what happens is a policy is made through that committee, and if it's passed through Congress and signed by the president, that then is sent to CMS to make a rule. And Dr. Megal is going to get more into how that works. Other important committees to keep in mind are the Committee on Health, Education, Labor, and Pensions, and the Committee on Appropriations, that they fund things. That committee does have a subcommittee on labor, health and human services, education, and related agencies. On the House side, you have the Committee on Ways and Means, which also has influence in terms of how programs are paid for. along with Committee on Appropriations and Budget, and a Committee on Energy and Commerce, which will have a subcommittee on health, as does the subcommittee on Ways and Means. Next slide. So that previous slide with that busy schematic was showing you 2 of the 3 branches of government with regards to Congress and with regards to the executive branch. So this is specifically the Health and Human Services, which is part of the executive branch. And you can see all the different executive agencies that will influence health. So in regards to research, your Agency for Healthcare and Research Quality falls under Health and Human Services. Some Human Resources and Services Administration does do some grant funding, mostly in education. The National Institutes on Health, which we'll touch on later in the talk, where there was a proposed reorganization and how that might impact our members of the Wound Healing Society. And then, of course, your Centers for Medicare and Medicaid Services, CMS, which is under Health and Human Services. Next slide. So if we have an opportunity at the end of this talk, I will show you how to sign up for notifications on CMS rulemaking, because there are multiple calendars within Congress and they can get quite confusing. When CMS releases proposed rules is when you can comment, and your associations can also send letters and comment as an association. We often, I think this past year, we did send out a rule with regards to an FDA ruling. And so it's important to be aware of when these proposed rules are come out so that you can list your voice to, and again, you are a subject matter expert where you can provide input. I'm now going to hand the talk over to Dr. Megal. Next slide.
Thank you, Dr. White-Chu. On that very topic of staying engaged and following things, just this very afternoon, there was a CMS online town hall, they called it. It was a MAC town hall, and I'm going to go over that definition in just a minute. But they had invited the US public, those of interest, particularly in the wound healing world, whether it be research or clinical, to speak on one of the proposed local coverage determinations on cellular-based tissue products. And it was very interesting being part of that whole process and hearing people speak from across the country. So it's a great way to get involved and to find out what's going on and to dig in a little bit deeper to find out how those things are going. And that just happened earlier this afternoon. And the website that Dr. White-Chu is going to show later shows you how to get involved and get on those lists so that you become aware of those types of things. But let's dive a little bit more into cms.gov, because there is a tremendous amount of information that we are responsible for knowing that sometimes we're not even aware that we're responsible for knowing this. So congratulations to you for tuning in and just letting us give you that very high level overview and share with you the resources that you can also tap into long after this webinar is over. So the first caveat I want to say is when we're talking about cms.gov, these guidelines are based on laws that have been passed related to Medicare A and B. So other insurance companies and Medicaid have the option, like they can look at the rules that have been passed by Medicare and then they make their own decisions whether they're going to follow them or not. So keep that in mind as we go through these definitions and some of the rules and the laws that have been passed, that they very much apply to Medicare, and then other people decide if they're going to go along with it. All right, key definition. So let's start with what a MAC is. MAC is a term often used related to Medicare. So Medicare is a national program, right? It's a United States national program. However, Medicare has decided that they want it managed in smaller districts. So we have what are called Medicare administrative contractors, and these are private healthcare insurers that are awarded these geographic jurisdictions to process Medicare AB claims or durable medical equipment claims. And I included both of these maps on here for you to show that when you're talking about the A and B MACs versus the durable medical equipment MACs, the country is divided up in different sections. So we always want to kind of maintain awareness of, are we talking about like an outpatient Part B issue that we're dealing with, or are we dealing with perhaps a supply issue through our durable medical equipment MAC? And then we know which documents to reference based on that knowledge. All right, so local coverage determinations. This was the topic of that online town webinar earlier today, specifically on one component of wound care. So an LCD by definition is a decision that's been made by a MAC. So it could be one specific MAC, or it could be a group of MACs working together on whether a particular service or item is considered reasonable and necessary, and therefore covered by Medicare within the specific jurisdiction that that MAC oversees. So LCDs can vary by MAC, but we are seeing a trend where more of the MACs are getting together because it's a lot of work to review research, and they're coming to consensus as to what the MACs are going to agree upon. So I've got two examples for you. So again, I pulled up the AB MAC jurisdiction. So these particular services. So the MACs have defined what debridement services are, and there's two documents. There's the LCD, which is the local coverage determination, and then there's also an article, and the article gets more detailed into what needs to be documented in the record and the types of ICD-10 codes or the coding that needs to be in place in order for these services to be considered reasonable, medically necessary, and therefore be covered. Again, so wherever you are watching the webinar, take a look at the color of the state that you're in. So for example, I'm in Wisconsin. So I'm in J6, which is the NGS MAC jurisdiction. So I would reference the list on the left. I would find NGS, which stands for National Government Service. I find my LCD L33614 with the adjoining article A56617. I would look for you can easily go to cms.gov and just type in debridement, pulls them up, but then you want to make sure that you find the one that is pertinent to your MAC jurisdiction. And I've also heard that some folks work in multiple states. So for example, if you work in Rhode Island part of the year, and then you work in Florida the next part of the year, you do have responsibility for understanding the MAC and the LCD determinations in those different areas, because they may not match. So it's a little extra work when covering multiple states. All right, second example. This is the cellular tissue product application. Now, this is a brand new LCD that's just been proposed and approved to go live in February of 2025. So I have all the updated articles and LCD numbers on the screen for you. And this is what was the subject of the town hall talk earlier today in CMS's MAC webinar. Again, these LCDs are extremely similar, that they're kind of being treated as a unit. So they all specify pretty much the same thing as far as documentation, eligibility, and how cellular-based tissue products can be utilized in the clinical arena. So whether you're a clinician or a researcher, if you're a researcher working on something that would come down the pike in this type of capacity, it's extremely beneficial to understand the rules and regulations around how these work, so that as the development process takes place, you know the hoops that the substrate will have to pass through in order to become usable in a wound center. All right, so there's other policies besides debridement and cellular tissue product that are very specific to wound management. And these are all, again, found on cms.gov. There are things like documentation for negative pressure, hyperbaric, pressure reducing surfaces, routine foot and nail care. There's very strict guidelines about when that can be billed for in a patient care. Electrical stimulation of wounds, there's near-infrared spectroscopy, topical oxygen therapy, blood-derived products. Now, I'd like to point out that when there is an LCD, it's not always an LCD of coverage. There's two of them on here, near-infrared spectroscopy and topical oxygen therapy, that those LCDs are specifically non-coverage policies. So they've reviewed the evidence and made a determination that the procedure will not be covered because there's not enough substantive evidence to have it move forward yet. All right, let's go back to the maps. So key definition, we talked about our maps. We looked a little bit at the AB MAC jurisdictions and the impact. Now let's look at the DME MAC jurisdictions and how some other definitions that play into how our durable medical equipment and our supplies play into our wound care practices, as well as research. So another key definition that comes into play for people who are developing wound care products or ordering wound care products in the clinical environment is something called Healthcare Common Procedure Coding System, nicknamed HCPCS coding. This is a collection of standardized codes that represent medical procedures, supplies, products, and services. So all of the wound care supplies that are out there that have gone through the approval process through CMS to have a HCPCS code awarded, that means that we have a code that allows them to be billed. So these are used to facilitate the processing of health insurance claims related to the care. So let's take another example. Here's the AB MAC jurisdiction, and we have a surgical dressings policy that all of the MACs have agreed on. So even though it's called a local coverage determination, all the MACs have come together and agreed on this surgical dressing policy. This policy spells out in extreme detail what types of wounds dressings are covered for, what has to be documented in the wound assessment, and what types of dressings are covered, those that have with their HCPCS codes, and how frequently they're covered for, which is often based on the FDA approval guidelines of the dressings. So let's take a look at some examples. All right, so dressings for minimal to no drainage. This again comes directly out of the LCD. So you can see the HCPCS code, the examples in the second column. We have the HCPCS codes that apply to hydrogels and transparent film on this slide, which is the minimal to no drainage example. You can see how the change frequency is spelled out. So like a gel filler, 3 ounces per wound, non-bordered, 1 daily, a bordered hydrogel 3 times per week. Transparent film covered for up to 3 times per week. And truly, when putting together a DME order on behalf of a patient, we're not really allowed to step out of those lines unless we have documentation to support medical necessity. So as other examples, you can see then the light to moderate drainage category includes the collagen HCPCS codes as well as the hydrocolloid HCPCS codes with their allowed change frequencies. Dressings for moderate to heavy drainage. We have a few more categories here. We have the alginates, jelly and fibers, we have some foams, some specialty absorptives. I'd like to point out under the composite category how composite dressings are the HCPCS code is usually decided upon based on what the majority of the ingredient is in those dressings that are a mixture of different things. In this case, a lot of composite dressings are primarily foam, so they fall into that up to 3 times per week category. And then do know that there's a lot of special notes in this particular category. For the alginates and the gelling fibers, they've called out that the dressing size needs to equal the wound size. If you're using a foam, you can't stack foams together in the current rules. If it's used for a secondary dressing, the exudate must also be documented as heavy. So very specific do's and don'ts. Lastly, gauze. The gauze has a whole series of HCPCS codes, so it does have the potential to be covered by insurance. We have the impregnated gauze, which usually has some type of antimicrobial in it, along with zinc paste bandages, which are often used in the wound clinics. All right, moving away from HCPCS coding then, let's talk a little bit about NCCI edits. So this comes into play in the billing and coding component of the visits. So the idea behind an NCCI edit is to prevent inappropriate payment of services that should not be reported together. We do a lot of procedures in wound care, and we often combine those procedures together. The NCCI edit portion of the website is updated quarterly. So this one probably goes through the most changes, the most frequent. So it's highly recommended that you have a group of people in your practice that kind of keep an eye on these to make sure that we're up to date regularly. I included the website there for you. All right, common CPT codes. So I just pulled out some of the most common ones in wound care practice today. So we have our debridements, chemical cautery, negative pressure, our CTP application, multi-layer compression wraps, total contact casts, different kinds of imaging that can be done in the clinic. So let's put this into practice. So what is an NCCI edit? Again, it's going to tell me what I can bill in a procedure and when other procedures roll up into that main procedure. So if I have a patient example for you, I have a lovely 65-year-old lady. She's coming in for a consult to the clinic. She's got a venous leg ulcer. We know it's venous. She's got the hemosiderin staining. She bumped her leg on a table, took out a pretty good size amount of tissue, and her wound is measuring 2 by 3 by 0.5. She's got an okay vascular exam, and she's got 3+ pitting edema noted on that exam. So my medical decision-making around this care is I need debridement, I need to get in there, and I need to get out the necrotic tissue to promote her healing, but she also needs compression. And you'll see that there are CPT codes assigned for both of these. However, even though I'm carrying them out in the same visit, I cannot bill them both together according to the NCCI edits. Based on the table that they generate on that website, I do know that I can charge only the debridement code, and the compression supplies and application fees are considered within that debridement charge. So we create ourselves kind of a hierarchy table in our clinic, looking at what the most inclusive procedure is to the least inclusive, so we know how things roll up. And most of the billing and coding software packages that the hospitals do purchase and employ have, what do they call them? They call them filters that the bills will go through to kind of catch these to help us make sure we're doing it on the up and up. One last key definition I want you to take away with today from CMS is the HCC coding, also known as hierarchical condition category. So HCC coding is a method of estimating or adjusting for risk on our patients. Anybody who works with wound care patients know that many of them are very, very sick, many comorbidities. However, if we only code our visits for the particular wound that we're taking care of, so like an ulcer code, but we don't code for all of the comorbidities that we're addressing, we're not capturing the full picture of how sick our patients are. So the HCC coding is encouraging us to encapsulate and capture relevant patient conditions to wound healing in those ICD-10 codes. This helps to estimate the future healthcare costs and determine reimbursement. And what I've learned is that how we code today, it results in what our clinic is going to get paid 2 years from now. So they always look 2 years retro to figure out what the billing is going to be for the future. All right, let's do a coding example. So if we're using the same patient, lovely 65-year-old lady with the table injured leg, my primary wound code, I can do a very simple basic wound code for leg ulcer right with fat layer exposed because she got all the way in there. But I want to make sure that I'm addressing the secondary comorbidities. Let's say I notice on exam that she has lymphedema. I'm gonna code for the lymphedema, and then I'm gonna have a plan of care specific to that to actively bring in the lymphedema therapist into her plan of care. Likewise, if I wasn't too thrilled with her pulses, I look back, I see she's got an old ABI from her past, the abnormal anchiobrachial index, which gives me a hint of some reduced blood flow. I'm going to make sure to get vascular on board sooner. And likewise with the diabetes, I'm going to make sure that we're addressing it and we've got her connected to the right people for getting that under control. I'm going to hand it back to Dr. White-Chu.
Thank you, Dr. Megal. I think that was extremely informative, and I appreciate you going over all that and explaining it really, really well. So I think a lot of us get overwhelmed, especially in our world of constant media coming at us, having being on our phones or tablets and having social media and being inundated with information and what's right what's accurate or not. So, I just like to share about different ways that I stay informed. I do have a bias with regards to liking my local newspaper. Part of it is I think it's a pretty decent newspaper. I also was raised in a family of journalists, so that's probably also my bias. But some kind of journalism that has an editor where they do fact checking is always helpful. So I do subscribe to my local newspaper. There are also some podcasts out there that can keep you informed in the latest health legislation. One in particular that I like is called What the Health, Health, Health. What the Health. These are journalists and pundits who discuss, and it goes every week to where they have to even say a disclaimer at the beginning. News changes fast, so what we say might be outdated today. But they do go over, what's been the discussion in Congress over the last week, and also in the executive branch, and going over any of those health issues. And lastly, in our, of course, there's the Wound Healing Society. So being a member of an association that does any kind of advocacy, such as our Wound Healing Society, does help us stay informed. And we do have a platform where we will blast certain issues that we think our members would be interested in hearing about, and commenting and reaching out to our legislators. Next slide. You might also be aware of the Alliance for Wound Care Stakeholders. If you, when you get these slides, when you click on that link, it'll take you to their website, but you can also easily Google them. So the Alliance is a group, is composed of multiple associations that touch people, taking care of people with chronic wounds. So it's not just the Wound Healing Society as a member. You can't join as an individual. You, as a Wound Healing Society member, are then a member of the Alliance. And we do have 2 representatives that serve on the Alliance that give us information that might impact our patients and our research. They are not only an advocacy group, they also have a lobbying arm where they have people who actually go to the Hill and meet with members of Congress. So lobbying is a separate IRS designation. It's not something that Wound Healing Society has, but we are collaborate with the Alliance, where we definitely have some overlap in advocacy, and also the Wound Healing Society might have other issues that are just particular for our members. So know that this is a resource that the Wound Healing Society does utilize. Next slide. So how do you find out about relevant policy? And even more importantly, how do you know where, if anything's even happening to that bill? So this is a way that you could do an advanced search. And I think we, looking at our timing, I'm pretty sure we'll have some time at the end of this talk for me to pull that up and show you in real time. If my screen sharing will work. We were having issues with that earlier. So we'll see how that goes. I might be able to direct someone else to do it. Next slide. So I want to bring to your attention the advocacy efforts that we've done in the past year through the Wound Healing Society. There was a proposed rule that I've checked on several times. It hasn't moved anywhere, but through the Federal Drug Administration back in February, they published a proposed rule that would classify certain wound dressings and liquid wound washes with antimicrobials and other chemical preservatives. We heard from our members, and we also, in terms of the challenges that might run with this, and advocated changes to that proposed rule. Again, the rule has not yet been finalized, at least not as me checking even just as recently as yesterday. So I think they definitely got over 77 comments. Many were from our Wound Healing Society members, and we appreciate you informing the Food and Drug Administration as to the pros and cons of that type of rule. There are also several bills that we have discussed with our members and blasted through our advocacy platform. One, as I mentioned earlier, the National Institute on Health, which is within the Health and Human Services Executive Branch. There were bills through the Appropriations Committee and through a second committee, and I'm sorry that I'm blanking on that right now, but it was to reorganize and replace the National Institute on Aging with the National Institute on Dementia. Many of you might be aware that the National Institute on Aging has provided funding for skin and wound research. And so reorganizing that into just working with dementia would not, well, first off, not all aging is dementia. And second, it really would be a problem for our members and for our patients. One of our other members noted that during this reorganization that it would reduce biomedical funding. So definitely for our biomedical researchers, we wanted to give an opportunity for them to voice their concerns for this reorganization and concerns about funding. Next slide. There was another bill that House Bill 7513 it was a confusing bill the way it was written, but we wanted those clinicians who were working in long-term care to be able to voice concerns about the minimum staffing rule either for or against. So we didn't necessarily make a recommendation, but wanted to make it aware for our members that there was a bill on the floor that people could be aware, or excuse me, not on the floor, it was in committee, that people could be aware of. These other ones, Senate Bill 2016, Senate Bill 1636, and House Bill 7623 all dealt with the telehealth access. So to continue telehealth, where really that was leveraged through the pandemic and continuing to use that. Many of us recognize how telehealth has helped us provide care, especially in rural areas, and also for those patients who have difficulty getting to clinic, even if they're not in rural areas. I, for one, really like using telehealth for taking care of my patients living with spinal cord injury and a pressure injury, that if they don't require any debridement, but just need guidance on their care and oversight, and working with home health in their home, that it's been really wonderful to leverage. So that is currently on our advocacy page at this time. We highly encourage, if you have not already done so on this call, to go there. It's very simple. All you do is click on the advocacy platform and click on the bill. We want you to tell your story, because stories are actually what matter. When we throw a bunch of data at our members of Congress, they kind of go, oh, okay. But if you actually give a concrete story of how telehealth has really helped, or taking away telehealth will be a problem, then they're more likely to listen. And then the last one was, which is also on our advocacy page, is House Bill 10073, the Medicare Patient Access and Practice Stabilization Act. The majority of our patients are Medicare beneficiaries, and we know that there have been cuts to Medicare every year. There's a proposal for yet another cut, and there's been both a Republican and Democrat that have come together to stabilize this payment issue. And it's not just for physicians. This is for all types of clinicians, our physical therapists, our occupational therapists, our long-term care, not long-term care, but our post-acute care facilities. So really trying to stabilize these cuts to continue to provide excellent care for our patients. Again, I encourage you to lift your voice and tell your stories and raise your concerns. Next slide. So what can you do? A lot of people feel at a loss. I think a lot of people in the current political climate feel that we have a pretty dysfunctional government. And at times I would agree with that. But there is, as I hope I outlined for you, there's still a method in place, checks and balances. So what you can do to be aware and involved is signing up for the CMS newsroom, which again, I'm hoping to show you how to do that. And signing up for the federal registrar, that makes you aware of certain rulemaking, either through CMS or FDA. I encourage you to subscribe to a newspaper and read it, and engage in associations such as the Wound Healing Societies, and write to us. If you find you're like, hey, I'm having, I just noticed something in the news about this bill that's coming before Congress, and I think the Wound Healing Society should either take a stand on it or at least make it aware to the members. We want to hear from you. This is super important. There's way too much information for all of us to try and stay on top of. All of us are volunteers, and we're doing the best we can to be aware, and so it would be very helpful for our members to come to us. and let us know what they are finding out. Next slide. So that's Dr. Megal. You can do that story where
Yes, we had an opportunity to go to Madison, Wisconsin and do some advocacy for some issues related to nursing practice in the state of Wisconsin.
Excellent. And then next slide. I live in Oregon. We have voted for by mail for decades. So my husband and I like to go to a tea shop. He reads the pamphlet, and I usually get online and read a bunch of articles about the candidates. So my point is vote. It is a privilege, and frankly, I think an obligation of being a citizen. So thank you very much, and we will take questions. And if I can share my screen, I'll try and show you how to get online on some of those websites we mentioned.
Thank you, Dr. White-Chu and Dr. Megal, for the wonderful presentations. It was very informative, gave us like a comprehensive overview to understand our governmental system and healthcare policy making. And actually, I liked at the end that Dr. White-Chu showed a lot of resources that is available for everyone to be informed in real time. And there are some questions which we would like to address, and also if there is some time that Dr. White-Chu can show us a demo on the cms.gov. So one question, I know some of those already answered during like the session, but one of the questions is what resources are available for WHS members to direct their questions or concerns about any bills or policies to the society?
That is a great question. And actually, I would love it if our society moderator could maybe answer that question, because it would be nice if there may be I don't know of a way that we can do it through the advocacy page where we could write, but you've just given us a really great idea. Or is there an email that members can email when they log on to their membership, or contact us link?
Yeah, I would think it would be the easiest way through their membership page, or like just like emailing the society. And of course, we have a lot of committees communication that we can direct the questions to the specific committee, and then we can address those questions and move forward from our regularly monthly meetings. So this is maybe available resource to the WHS members. And also there is another question. How can WHS facilitate collaboration between the policymakers and the healthcare researchers to ensure the health policies are evidence-based and effective? This is for both Dr. White-Chu and Dr. Megal.
Right. So I think because we do, and Dr. Megal, you're more than welcome to jump in on this one too. Because at least from the policy standpoint, when making actual, bringing a policy that you would build in a committee, the Wound Healing Society does not have, as I mentioned, doesn't have a lobbying arm. We've talked about doing meetings on the Hill. That does require finances that might be quite challenging. I think the best leverage point that we have at this point is our advocacy platform, where we've been sending blasts on Voter Voice. In that point, you can tell your story about a policy that might be coming up that would impact your research or your patient care. And that doesn't mean you don't put any data in that story. You just want to lead with a story, and probably also have some bullet points of data where people will, we have to think about how quickly people have to go through emails. So I think that's one way of collaborating. You can also, and keep in mind that when you go through our platform, it automatically, you don't have to even think about who your legislator is. It figures it out by you putting in your address.
Thanks. I'd like to add just a little bit kind of from the individual activist opportunity. One of the things that I've heard and I've experienced as I've logged onto some of these MAC webinars where they allow people to either, you're either a listener or you sign up to speak, and you're given a certain allotment of time to provide your view. What I've noticed is that the participants are very heavily based in industry, but they're not hearing enough from clinicians who need to tell, we need to tell our stories. We need to tell the stories of the impact on our patients away from the perceived bias of industry. Just as an example, on the one today, I was only able to listen to the first hour, but I just took notes, and the first three major speakers all came from industry, and then the CEO of the Alliance for the Wound Care Stakeholders also made a statement. So I did hear that, and it was a very positive statement. But those individual voices and stories, there's opportunity to get them out there when we find those avenues.
Wonderful. I think Dr. Lisa Gold has a comment if she wants to go live and comment, or I can just read Dr. Gold. Okay, so she's just saying that the Alliance is trying to fight the NCCI edits about reimbursement for the debridement and compression in the same visit. She is saying they met with them and the small group voiced understanding, but CMS did nothing, and she's continuing to work on it. I think we have. Go ahead.
We still have about 10 minutes.
Oh yeah, that
Oh,
was
sorry, any
my
more questions?
my suggestion. If no more question, then we can go for a demo if your technical.
I will do my best. I
Yeah.
was trying to share my screen earlier, so let's see what happens.
Okay.
Tell me if you see what says, looks like the Federal Registrar.
Yes.
Oh, yay. Excellent. Okay. So this is one in particular website that is the Federal Registrar. So you do have to make an account. So I will sign in. I need to make sure. This is where we have to keep all our passwords everywhere. Give me 1 second. Okay. So what I've done here is I added to a folder. N means it's a notice. So this was one that was published back in December 2023 by the FDA, talking about real world evidence to support regulatory decision making. So that actually answers your question. How real world evidence is defined is probably put in that notice. This is the one that we mentioned earlier, where it still is a proposed rule. It hasn't seemed to move on. So where it's medical devices and the classification of wound dressings, and then also this other one I clipped, which was the payment changes. So these are ones that I am following. So this is a way that you can do this. You can, I think I put together, so my subscriptions, you can put together a subscription. I am a geriatrician, but mostly what I put in here were any public inspection documents that say dressing or wound, and that tends to capture quite a few. So that's enough. And I will get some very funny emails about marine sciences and that care, because animals need care too, and they have dressings apparently. But anyway, just know that, if it looks important, then you can click on it and see what's going on there. So that's the Federal Registrar with regards to rule making. now let's move on to, actually, let's go to the CMS first. If you want to be on the CMS newsroom, you can subscribe. They have a blog, they have press releases, and you can put together a subscription like anything else, and probably even a digest if that's what you would prefer, where it maybe comes once a week, and you can hit on the most important issues of what you prefer. So definitely sign up for the newsroom if you're very minded about CMS. And then Congress.gov. So I'm already in my account. And when you look at, see, so what you can do is you again have to make an account and you put in alerts. So I have all these alerts for these acts that we talked about. The Medicare Patient Access Practice Stabilization, these telehealth acts, these three. I'm a geriatrician, so protecting America's seniors' access to care. The Silo Act, that's a loneliness in older adults, as is this one. There's 2 House bills on that and a Senate bill as well. So what you can do is, sorry.
So we are
Say
still
again?
seeing the Federal Register. This is the
Oh,
current
shoot.
screen.
Okay, okay. I needed to click on that. Sorry.
Yep.
Okay, so I didn't realize that. So this is the CMS newsroom. I apologize. And that's what this, you see the CMS newsroom now? Okay.
Yes.
And then Congress.gov, this one, you make an account and then you can go to alerts and you can just search. I mean, if you're going to search healthcare, you're going to get a lot because it's not just going to be bills. You'll see you can uncheck all of these. It might take me a little bit. And then let's say all you want to know about are legislation. That's going to be pretty much your bills. Notice I also am just looking at this Congress. You can look at past. And notice it's very broad. So there's care and there's health. And it will be across the spectrum. Okay. When you sign up for alerts, I'll get an email. So for instance, let's go to, on my particular alert, let's go to this top one on the Medicare Patient Access and Stabilization. When you go into it, it shows what's happened so far. So the only thing that's happened is it has been introduced. Specifically, the actions are, it was introduced in the House. Remember how I talked about all those committees? It was referred to the Committee on Energy and Commerce, in addition to the Committee on Ways and Means. And then, and so that's what's happened so far. So no further actions. But what I have on my alerts, you can edit your alerts, and I pretty much just want to know actions, bills, but you can get all this other information if you want, but then you're getting a lot of emails. So, what are questions people have with those strategies?
I think this was great demo, and the people would be exploring it, I know, after the session. If we still have any questions.
There is one other, actually, I would like to show people our advocacy page, if that's okay.
Yes, go ahead, please.
Okay, let me get onto that. Okay, so you'll see when you go to the Wound Healing Society, and then you click, I'm not logged in, so it's probably going to force me to log in, but then you go to our advocacy page, and you'll see these 3 opportunities. We're hoping to augment this a little bit. We'll even show you past campaigns. But then let's say, okay, so I want to make I've already submitted my comments, but I could click on here. Oh, it does know it's me, good. And this gives the bullet points of why the Wound Healing Society is calling it to your attention. but then you get to put in the message body the stories that are important to you and any data that you'd like. It then knows my address, now you do, and it will send the message to the to your legislatures. And I actually have already, even though Blumenthal is leaving Congress, he did write back to me about telehealth, and he's like, yes, we are going to support these endeavors. So that was nice to hear from him.
Oh, that's great. Thank you very much for this demo, Dr. White-Chu, and the resources that is available for the members in the WHS and non-members as well. And thank you, Dr.
So
Megal,
Dr. Gould had I saw Dr. Gould had a question that I wouldn't mind answering if that's okay.
Yes.
Yeah. So
Go ahead.
Dr. Gould asked, when it's referred to a committee, what is happening behind the scenes? So when you have the first draft is proposed in a committee, and then everything's about jurisdiction. So, okay, let's say on the Medicare Act, whatever committee it came from, it's like, okay, well, how are we going to pay for it? The fact that it went to Ways and Means because it was in the House, that's how they're going to talk about how it might be paid for. And during that time, they do what's called markup. And they are marking up that act and making edits, and then we'll continue to push forward until it can then make its way out of committee and then be brought before the House to be voted. And then that's when I think sometimes the media gets a hold of it. It's like, okay, it's passed in the House, and then would it pass in the Senate? And then the president would then have to sign off on it. Sometimes, especially during the end of the year, you might find that there are similar bills from both the Senate and the House, and those are actually most likely to pass because they'll come together and they'll get pushed all together and marked up, and then finalized before going to the president.
Thank you. That's a ton of information from the two of you, and really useful. And I think the fact that we're also recording this and it's going to be on the YouTube channel soon is also going to be really helpful for people who maybe didn't take screenshots or write the links down quite quickly enough. But thank you all for attending the last WHS webinar of 2024, particularly this first policy webinar brought to you by the Education Committee and the Government Relations Committee together, and Wound Healing U. So as a reminder, this recording will be available on the Wound Healing Society YouTube channel and the Wound Healing U website in the next few weeks. And we will be working on the Education Committee and hopefully in collaboration with Government Relations to bring you a new series of webinars in 2025. Thank you, everybody. Good night.
Thank you.